This is a case synthesis presented by Group 4 Occupational Therapy students, school year 2017 to 2018, in Research Methodology 1 course, entitled The Effectiveness of Cognitive Rehabilitation for Elderly Patients. The main objective for this synthesis is to determine the effectiveness of cognitive rehabilitation for elderly patients. Moreover, the objective that is to determine the effectiveness of cognitive rehabilitation is an intervention type of research question. Thus, the best study design that would best address the objective of the synthesis is the controlled trial. Before we discuss about the results and contents of the gathered studies, cognitive rehabilitation will be defined. Cognitive rehabilitation is a program of guided therapy to learn or relearn ways to concentrate, remember, and solve problems after an illness or injury affecting the brain. It is a structured set of therapeutic activities designed to retrain an individual's ability to think, use, and make decisions. The focus is on improving deficits in memory, attention, perception, learning, planning, and judgment. There are many intervention strategies and techniques used to help reduce, manage, or cope with cognitive deficits. The desired outcome of cognitive rehabilitation is an improved quality of life or an improved ability to function in home and community life. The group utilized EBSCO in finding the following articles. First is effects of a multidisciplinary cognitive rehabilitation program for patients with mild Alzheimer's disease. Second is cognitive rehabilitation for Parkinson's disease dementia, a study protocol for a pilot randomized controlled trial. Third is the effect of cognitive rehabilitation on improving cognitive function and activities of daily living among elderly patients with stroke at Asyut University Hospital. Lastly, a pilot study on the benefit of cognitive rehabilitation in Parkinson's disease. So for the study design, majority 3 out of 4 of the selected studies for this synthesis is designed as a controlled trial or a variation of it. For participants in sampling, it is found from the articles that the selected studies included participants that are aged 60 years old and above. And in getting the participants, it is reported that simple random sampling was the chosen method of selection for each study. For data gathering procedures, the gathered information from the articles tells us that the studies utilized a parallel design. Pre-tests and post-tests were also reported to have been used in the studies, and 3 out of 4 of them included a follow-up assessment after an indicated span of time. Participants were generally grouped together into experimental groups, where the interventions were administered and the other set being the control group. To add an exception of that, one article mentioned that the participants were divided into 3 groups. In general, the statistical analysis mentioned in the articles were mainly used to identify, sort, and compare the variables present in the given studies. One main trend in the articles was that the baseline values from each group, whether experimental or controlled, were compared. Other data analysis methods were used to test for significance of the variable and to check for differences in the variable within the group itself in assessment stages. For overview of results of all the articles, for the first case, there is no significant difference found on both experimental group and control group. Based on the results of SKT, it was seen that patients in the experimental group remained stable while there was a significant difference in the results of patients in the control group, specifically in the attention subscore and the total SKT score, which indicated that there was a decline in the cognition of the patients. Between the multidisciplinary cognitive rehabilitation program and depression, there was a reduction of depressive symptoms in patients under the experimental group. There is also a significant difference in the intervention and quality of life of the patients in the experimental groups. Another significant difference was noted between the caregivers of patients that received the intervention and depression and quality of life. Although the results of patients in the experimental group in the neuropsychiatric inventory did not show any significant difference, the caregivers, however, showed a positive effect because the significant difference of p-value is equal to 0.02 was seen on the neuropsychiatric inventory distress score. For the second article, there was no results stated in the case. For the third article, the results of the assessment tools showed that there was a statistical difference between pre, post-test, and follow-up between the two groups. There is a p-value of 0.000 for all assessment tools. This means that the study group improved immediately at post-test and in follow-up. For the last article, the results showed that training with brainstem improved cognitive performance of patients with Parkinson's disease, and the effects in some cognitive domains were visible after 3 months. Among the groups, the trained group of HCs showed the largest benefit from training. The continuous adaptation of the level of difficulty to participants' performance acts on both motivation and reward for success. The findings not only strengthens cognitive functions, but also support self-efficacy and emotional well-being. In conclusion, the most common parameters used in the studies was the use of computers for cognitive rehabilitation, wherein most tasks or activities were done through the use of computers. Most of the activities targeted memory and attention. One difference of the articles is that one study included the following activities in the program: speech therapy, occupational therapy, art therapy, physical training, physiotherapy, and cognitive stimulation with reading and logic games. Cognitive rehabilitation can be chosen as a means of trying to either improve or maintain the current living situations of people afflicted with neurocognitive diseases such as Alzheimer's disease, Parkinson's disease, and even stroke-related dementia. The results of the studies tells us that there are improvements that were recorded after the specific cognitive rehabilitation technique was implemented. Although changes range from small to moderately significant improvements, it is also established that cognitive rehabilitation can create changes not only on cognition but also the occupations.